It's informative. It's healthy. And it's the news. Welcome to the Health Connection. This week's episode is PEP and PrEP, protection from HIV.
Good morning and welcome to the Health Connection, your source for community health news. Welcome. I'm here today with our Chief Medical Officer, Dr. Stephen Santiago. Welcome.
Hi, Jonathan. It's a pleasure to be here.
So you got back on Saturday from the World AIDS Conference in Paris, yes?
Correct, yes.
Welcome.
Thank you.
Back.
Yeah, it was exciting. Lots of great things going on in the world of AIDS research.
Indeed. Today's show conversation is about PEP and PrEP. It's a discussion. Many people are talking about all the amazing things that are happening regarding treatment and research and more. But PEP, post-exposure prophylaxis.
Correct.
Now, what is it? Who should use it?
Well, post-exposure prophylaxis was first used in the 80s when AZT was developed to prevent providers, nurses, etc., doctors that had occupational exposures, needle sticks, etc., from getting infected with HIV. It was very complicated in those days, many pills, many times a day, but it was 85% effective. So then we decided, hey, what about people that are having non-occupational exposure? So in other words, via sex, people at risk for getting HIV to prevent them from getting HIV. And so now post-exposure prophylaxis, or PEP, can be given in terms of 1 pill a day as long as it's done within 24 to 72 hours of the exposure. And that is done for 28 days, and it helps prevent somebody from getting HIV, anywhere from 85 to 100% effective at preventing HIV if it's taken correctly.
And that is something that one can find at Care Resource?
Yes, Care Resource, we're pioneers in providing all services related to HIV and preventing HIV. In fact, a lot of emergency rooms, although they're capable of providing post-exposure prophylaxis, will refer patients to us because we have such an integrated approach that we actually have a pharmacy on site that can help patients get on the medications ASAP, so within hours. We have patients that come from health promotions, they come down to medical, we'll see them even without an appointment. We'll see them within 24 hours to make sure they get on the medication to prevent them from getting HIV.
I love that synergy, the quickness, how things are just so, can get done right away, one-stop shop. Yes. Check out actually Care Resources' new commercial we have one right now called Post-Exposure Prophylaxis. It's playing right now on Atlantic Broadband.
It's time to wake up, South Florida. If you were recently exposed to HIV, you now have time to do something about it. The CDC recommends PEP to prevent an HIV infection. To be effective, PEP must be started within 24 to 72 hours of exposure. PEP should only be used in emergency situations and is not a cure for HIV. Make time to prevent a lifelong infection. Every second counts. Compassionate, competent, and committed care. Your community source for healthcare is Care Resource.
So in addition to PEP, post-exposure prophylaxis, Care Resources also provides PrEP, which is pre-exposure prophylaxis. Gotcha. And to talk about that more today is Paul Seligman. Paul, welcome to the show.
All right, thank you. Thank you for having me here.
Anytime. So you're at Care Resource, and you are our peer navigator.
Yeah, and I'm part of the health promotion team, and we're part of exactly the synergy that you're talking about. We're there seeing people who are coming in for testing, and these are the people who were told in 2007 that you're probably going to become HIV positive during your lifetime. So they're sweating through every single test they get through. I see them, talk to them about PrEP, and when people hear about PrEP, and it's such an exciting moment right now, there's so many new things coming, and pre-exposure prophylaxis, post-exposure prophylaxis, all of these biomedical strategies are so effective that the person who before used to think it's going to happen, it's an inevitability in my lifetime, they don't have to think that anymore. That makes them bloom. This is the thing that I get so excited about, that I'm there at Care Resource, where we have this one-stop shop approach. We have the testing, we have the providers on board, we have the pharmacy right there, we have programs for the uninsured, we have, we're an FQHC, so it's sliding scale fee, and for the uninsured, we even have a voucher program to help them see a doctor, and we just launched 3 weeks ago our same-day PrEP treatment program, which means that the day you see your medical provider, you leave that day if you want to be on PrEP, and this is something you've decided, I should be on PrEP to stay well. You leave that day with the prescription in hand, go to our Walgreens, there you go, you started.
Wow.
Yeah.
So tell who should be on, or who do you recommend?
Anyone who is considered a high-risk population, and that by the CDC standards, one of the things that they take into account is if you're having multiple sexual partners, this is something you should definitely have to consider. It's not just gay people, because this is the other misconception. This is not a gay problem. We still, even in today's world, we're dealing with about 22% of all the infections are women, heterosexual women. So women need to consider this. Men who are in high-risk populations need to consider this. For those of us who speak Spanish, we're at a higher risk than the non-Spanish speakers. African Americans are at a higher risk than non-African Americans. So for all these populations that are high risk, we have this fantastic strategy. It's very tolerable. It's very easy to manage. And we're there to provide it. So,
Amazing.
yeah.
Actually, Care Resource also has a commercial about PrEP as well. Here, check it out.
Are you up in arms trying to protect yourself from HIV? Did you know the CDC recommends PrEP to prevent HIV? Just 1 pill a day can help keep you safe. When prescribed in conjunction with safer sex practices, PrEP has shown to be over 99% effective at preventing HIV infection. Find out how 1 pill a day keeps HIV away. Your compassionate, competent, and committed healthcare is Care Resource.
Here today also with us is Mr. Marco Torrealbas. He works in our health outreach and promotions team. Welcome, Marco.
Thank you for having me.
So right now we're talking about PrEP, but before we go there, I wanted to talk about, out in the field, out when you do like your outreach and to the community, you see ground zero what is going on. What inspires you to do what you do every day?
Well, first of all, one thing that encouraged me to go on PrEP is to be a real voice to talk about the pill, about the treatment, because in that way I can really refer PrEP to people. I say, this is a very good option. This is a healthy option, even if you are engaged in any risk sexual behavior or not. You should try to play safe all the time. So that's the main reason. And also it helps to, let's say, remove the myths that a lot of people have about PrEP.
We're entering a whole new world indeed. So Dr. Santiago, what have you seen at Care Resource, regarding progress that we've made, and kind of the future of where we need to go, regarding PrEP and HIV?
Thank you. That's an excellent question. In the past, we've learned actually, as of probably 5 years ago, that we can do treatment as prevention for people who have HIV, and we have found actually that is 100% effective. If somebody has an undetectable viral level, meaning they have HIV and the virus is under control, they're taking medication, that person cannot transmit HIV through sexual encounters, and that's amazing. But that's only one part of that so-called toolbox. So, of course, we have safer sexual practices, if that's an option. And now we have, of course, pre-exposure prophylaxis, or PrEP, which the only treatment right now that's FDA approved is Truvada, which is that 1 pill a day option that we've been talking about. The great thing is that we're putting power into people's hands. In addition to the current version of PrEP, there are new things that are being investigated. PrEP is very safe. Truvada is very safe, very well tolerated. But we're investigating new options, injectable options and other options, so that it's going to give patients a choice as far as how they take PrEP, when they take it, and it's really an exciting time to be treating people with HIV and also people without HIV to prevent them from getting infected.
Wow. And Marcos, when you're out into the community and talking about outreach and talking about what we do at Care Resource, like how are you communicating the message of PrEP to the community? Like what's the message that you mostly communicate?
Well, you have to be direct with people. It's just one pill a day. It keeps the virus away, as the doctors say, and also, which is very important to tell people, like you don't need an insurance to have access to PrEP. You really can have access to PrEP through Care Resource. And as they told people before, it's super fast, it's easy, and it's super safe. In fact, the doctor can probably confirm this. Not everybody's gonna have like secondary effects or anything, or side effects of the pill. It always depends on people. I don't have any side effects, at least not till the moment. It's like nothing at all. And the good part is like I feel safe. I feel safer. I feel like like I said, you don't need to be in a very sexual risk behavior to get it, just because you want to play safe, and that's the best way to play if you are out there.
That's excellent, Marco. Yeah, it sounds like you put the power into your own hands to prevent getting HIV, and it's wonderful. And I'm so excited to be part of Care Resource and to be able to offer the voucher program that we have, so that patients who don't have insurance that need to get on PrEP can come in and say, hey, I need to get on PrEP, or if the health promotions department that does a test realizes that the person is at risk, it sends the patient to medical and says, hey, this person's at risk, here's a free voucher, we'll do the first medical visit for free, do the lab work, give them a prescription, and it's really exciting.
Paul, if you had any message for all those that are watching the show right now, what would you say to them?
I think that it's time for all of us who have been part of these risk populations understand that the risk can be mitigated. And it's not, there's no one here who's judging you, and it's not even about high-risk sex behavior or high-risk behavior, period. We are living in a high-risk prevalence zone. That means that if you're sexually active in this region, you're at risk. So if you want to help mitigate that risk and you're ready to do this, we have every tool to help you. Because these biomedical preventive strategies are effective, they're easy to manage, easy to take, very few side effects.
Well, Care Resource has facilities all around South Florida. We have an office in Fort Lauderdale off Oakland Park Boulevard. We have one in Little Havana. We have one in Miami Beach, 2 in Miami Beach now, and one. Wow, we're growing a lot. 3510 Biscayne. We have services there, but yet we're expanding too into 3801, and it's a very, very exciting time. We're out in the community, educating, providing healthcare, and we are the medical home, truly, for all those most in need. If one wants to find out more about Care Resource and the services that we provide, I suggest they go on to careresource.org. C-A-R-E, resource.org. Thank you guys for being here today.
Thank you,
for having
Jonathan.
us.
Thank you.
And we'll see you next week, on Wednesday at this time next week at 1 o'clock p.m. Thank you. Have a good day.
Watch the Health Connection live feed show on Facebook and YouTube every other Wednesday at 1 for your dose of informative, healthy news. Care Resource is located at 3510 Biscayne Boulevard in Miami, 3801 Biscayne Boulevard in Miami, 1901 Southwest 1st Street in Little Havana, 1701 Meridian Avenue in Miami Beach, and 871 West Oakland Park Boulevard in Fort Lauderdale. Don't forget to like us on Facebook at facebook.com/Care Resource, or follow us on Twitter at Care Resource FL, or subscribe at youtube.com/Care Resource.